Hi everyone, you're welcome to another episode of the Fertility Nurse. And in today's video, we'll be discussing on several things that would need to be checked. This is your pre-conception wellness check in summary. So if you're thinking of going for a fertility consultation, you want to see a fertility specialist, you've been trying to conceive for a while and you're like, okay, you've told your partner it's time we go see a fertility specialist, it's time we go seek for help. So these are the things you should expect on your visit to the hospital, right, or at the fertility center. So these are the things you should expect. It's called the pre-conception wellness check, right? So on getting to the hospital, just like any other hospital, you'll be monitored, your vitals will be taken by the nurses, and this is not just routine. It's not just to to make you feel like you're at your hospital, although that could be it, but then it gives the fertility team a pointer to what could also be a cause of the problem already existing, right? So you have cases like being overweight, which is a risk factor for infertility. Being underweight is also a risk factor for infertility, right? When your blood sugar is checked and it is elevated, it is also a risk factor for um, infertility as well. So your vitals are being checked, and all your weight, your height, your temperature, your blood pressure, and everything is being checked, and then you proceed to the blood work. So the blood work is usually done in the lab, and it's for both partners, just like the vitals check is for both partners. So during the blood work, you're being examined for different infections that could lead to infertility. Example: HIV, HCV, which is the hepatitis C virus, hepatitis B virus as well, chlamydia, gonorrhea, syphilis, and any other kind of infection that could predispose one to infertility. Another part of the blood work is the hormonal profiling, which is done both for the man and for the woman, right? If there is an hormonal imbalance for the male, which maybe a low level of testosterone, it can affect production of sperms, which can lead to infertility. And then if there's an hormonal imbalance for the woman, for instance hyperprolactinemia, which shows symptoms of producing breast milk when you are not breastfeeding. Some women discover that they are dripping breast milk when they've never been pregnant and they're not breastfeeding. That is your hormones are not balanced, right? And when your body sees that signal, when your body sees that the prolactin is high, it shuts down your ovulation, because it's already, your brain is telling your body that, oh, this woman is breastfeeding. This one is breastfeeding, she doesn't need to ovulate, right? So that could also be a revealer. So also for the blood work, you have a genotype check. You know, it could also you could also check for they could also check for the genetic carrier, screening and all, to check if there is any genetic predisposition in the gene that could affect the child, right? You want to get everything right. You want to be sure that you're on the right track. So another thing there, particularly for the woman, is the baseline scan, which is usually done on the second day of your cycle, of your menses. And from this scan, the shape of your uterus will be checked, the anatomy and everything, are there any fibroids, and everything will be checked, and all that will be documented, which will help the physician, the fertility specialist, and all the fertility team to properly give your preferred care. And then also there's another check for the woman, which is testing for the ovarian reserve through the anti-Mullerian hormone. This anti-Mullerian hormone exists in your body, and testing for it will tell whether your eggs are still young, are still viable, are still quality. A good level of anti-Mullerian hormone shows that your eggs are still okay. A very low level shows that something needs to be done about these eggs. Then we have the follicle stimulating hormone, which is the FSH, that's responsible for ovulation and all, to be checked as well. And also the thyroid stimulating hormone will also be checked, right? You check for the estradiol. All these things will give a pointer. Is this woman is her body conducive enough for fertility, for conception to take place? It is very important. Then another check for the woman is the HSG, which is the hysterosalpingogram. It is just checking whether your fallopian tubes are patent enough for the sperm to swim through. Fertilization occurs at the ampulla of the fallopian tube. The sperm gets into the vagina and travels down to the fallopian tube to meet the egg, even before the egg gets to the uterus. So these tests will show whether your fallopian tubes are patent, are open, because if the fallopian tubes are blocked, the sperms cannot get to the egg and fertilization cannot take place, and then pregnancy cannot take place. So that to be checked. And then you have the pap smear for the woman, and all is also necessary to check if there are any abnormalities, and also further consultations will be done, and then your treatment plan will be tailored towards your peculiar needs, right? Two persons do not have exactly the same treatment plan, even if they are the same age, even if they've had the same years of waiting. No two treatment plans are the same. So once all these have been checked, if it is being checked and you're good to go, tick tick, the doctor says you have no problem, and then it's fine. The necessary information that you need to guide you towards your fertility goals will be provided for you. But then if all these are checked and then there is an underlying problem, then it is a pointer to what needs to be done, right? So I hope that at the end of this video you'll be properly informed on what to expect on your first consultation at the fertility clinic. So thank you very much for watching, and as I would always say, I am rooting for the fertile you. Bye, and see you in my next video.